Living Well is brought to you by Northwest Cancer Clinic.
Now, welcome back to Wake Up Northwest Saturday. Today, we're kicking off our first Living Well segment focused on wellness for cancer patients.
And joining us now is the good Dr. Lawenda of the Northwest Cancer Clinic. Thanks for joining us. Of course, we really love having you in here today. Absolutely, our pleasure. And today we're going to be talking about cancer and nutrition when it comes to living well. So why don't you talk to us a little bit about what difference nutrition makes during a cancer treatment?
So it's a very good question. Cancer is different for everybody, and so their experience as they're going through treatments is going to be very different. And so we have to basically customize for each individual patient. And so I spend a lot of time counseling patients when I sit down with them on exactly what's going on with them, their overall health status, and then whatever their specific needs are going to be in regarding to how difficult the treatment may be for them. And so I have to spend maybe an hour to an hour and a half with my customization discussions for patients to tailor specifically nutrition and other aspects of lifestyle for them.
And as far as the customization, what does that continue on after treatment as well? Can you talk to me about that?
Yeah, it's actually very important that patients continue on with what I call an anti-cancer lifestyle afterwards. We focus on things such as inflammation in the body, which can be a key driving factor for cancer. Also, looking at their nutrient values, which I test for using a whole process called functional medicine. And that's basically lab testing to look for nutrient deficiencies, for example. And overall, basically just trying to optimize patients' overall body physiology so that they hopefully do better.
Now, I feel like there's so many different things about what's good and what's bad in nutrition out there. What do you think is considered good nutrition?
So good nutrition basically is, in general, it's going to be an anti-inflammatory type of diet. We always think about the Mediterranean diet. That's pretty much kind of become sort of the standard across the sort of the nutrition industry in terms of trying to help people make sure that they're getting enough plants in their diet. It's not specifically a plant-only diet. You can have meat, you can have poultry, you can have fish. But the more plants, the better. The less processed foods, the better. If you can afford organic, organic would be better for the toxic load issues and possibly even the nutrient value.
Awesome. So what is the best way to educate patients on all of this? Of course, we've got some great information from you here, but let's say they missed this segment. What's the best way to help them learn about a good diet?
Yeah, and even preventative care.
Yeah.
Absolutely.
Preventing.
So basically having a conversation with an expert in dietary and nutrition, lifestyle modification, as well as you're talking about just sort of the overall prevention aspects, because once you, for example, I'm an oncologist, once you develop one cancer, there's a greater chance that you can actually develop other cancers, and lifestyle factors are really important. So make an appointment. I do consultations with patients for integrative oncology at the Northwest Cancer Clinic. And spend, as I said, about 60 minutes to 90 minutes with patients, which is a lot of time, and then follow-up visits. And I do this throughout their entire cancer care.
And to learn more, if people wanted to maybe learn more about what you do and how you help them, what can they do? Where can they go?
So call the Northwest Cancer Clinic. I'm sure the information will be listed here on the website as well. And just ask to make an appointment for an integrative oncology consultation with Dr. Lawenda, me.
Awesome. Dr. Lawenda, thank you so much for being here today. It was very helpful.
Very informative. We appreciate that.